A 68-year-old man presents to the emergency department because of fever, abdominal pain, and rapidly progressive distension of the abdomen. His appendix was removed for an abscess 3 days ago. A CBC shows leukocytosis. Anaerobic culture of the peritoneal fluid needle aspirate showed a gram-negative pathogen. Which of the following, in addition to polymicrobial infection, is the most likely cause of the patient's condition? So is it Bacteroides fragilis, Campylobacter jejuni, Clostridium perfringens, Salmonella serotyphi, and or Shigella soni? Little complicated, but not as much if you know what the diagnosis is. So obviously this patient was suffering from peritonitis, which can be secondary to perforation due to increased intraluminal pressure. The increased pressure can be due to an abscess, which was the case in our patient. The most commonly isolated cause of anaerobic abscesses is Bacteroides fragilis. 99% of the flora in the intestinal tract are bacteroids. This is a gram-negative anaerobic bacillus. Bacteroides fragilis, it's difficult to treat because it's fastidious, difficult to isolate. It's also resistant to many antibiotics, but treatments include metronidazole and clindamycin. Peritonitis caused by this organism results from endogenous gut transmission due to trauma of the abdomen or emergency abdominal surgery. So this is something you need to keep in mind and remember, that if the peritonitis is caused by Bacteroides fragilis, it's mostly due to an internal factor which is happening. And it is also known for causing polymicrobial infections with other facultatives or strict anaerobes and responsible for a majority of the localized abscesses. Okay, pretty straightforward question. You just need to be able to identify the fact that this patient had an abscess, that abscess complicated and led to peritonitis. And one of the most common causes of peritonitis following an anaerobic abscess is Bacteroides fragilis.
Thanks for watching. Please give a thumbs up and subscribe for more.